Good morning, students. Today we'll be discussing about the anatomy of the oral cavity, the lip, the tongue, and the salivary glands. This is Dr. Yusuf Khan signing from Al Jof University. This is the specific objective which we will try to cover. Describe the specific features like the arterial supply, venous drainage, lymphatic drainage, and nerve supply of lips, the tongue, the palate, as well as the salivary gland. To begin with, the alimentary system or the digestive system has a very important role in digestion. So what are the different roles it will play in the digestive system? One, it prepares the food for absorption and utilization by all the cells of the body. So it helps in the digestion as well as the absorption of the food particles, which will be utilized for the whole of the body, all the cells of the millions of cells which are within the body. The food material not absorbed will be thrown out as feces, so that will come as the stool in the form of feces, that is not absorbed food. Digestion depends on both the exocrine as well as the endocrine secretions and controlled movement of indigested food materials through the gastrointestinal tract. So the digestion mainly depends on the exocrine as well as the endocrine secretions as well as the movement of the digestive system. So this digestive system or the alimentary system begins from the first part, that is the mouth or the oral cavity. This is the inlet of the digestive system. So this mouth will be surrounded by some very important structures. One is the lips. So these are the lips which will be the gateway for this alimentary system. Then the cheeks, which are on the sides. Then the hard and the soft palate. So the hard palate will be here, which is formed by the bone, and behind will be the soft palate, which will be made up of the mainly the muscles as well as the other connective tissues. Then we have the tongue and the salivary glands on either side. We'll discuss each one of them one by one. So these are some of the structures which will be within the mouth or the oral cavity, and along with that we have the 32 pair of teeth. To begin with the lip, so these are the lips. So these are nothing but the fleshy folds around the mouth oral or mouth orifice. So this is the oral orifice or the mouth orifice. Orifice means opening. So around this mouth, opening of the mouth, we have a fleshy made up of mainly the muscles and covered by the skin and the mucous membrane. The outer surface of this lips are covered by skin which is hairy, and where we can have the mustache and the beard everywhere. Okay, so the outer surface of the skin is hairy, but the inner surface is lined by the mucous membrane, so which is very similar to that of the mucous membrane of the oral cavity itself. So the inner surface is covered by the mucous membrane and the outer surface is covered by the skin, which is hairy in nature. And this mucous membrane which is in the inner surface will have the labial glands. There are two lips, the upper lip and the lower lip, and they are separated by a fissure or the opening. This is called as the oral fissure. Okay, so this is the oral fissure which is covered by the upper lip and the lower lip, and they are joined at the sides. At the sides, this is will be called as the angle of the mouth, where the two lips will join together. That will be called as the angle of the mouth. So here you can see the lip, and this is the oral fissure through which the food particles will enter. So this forms the entry. Now coming to the beside the lips, we have the cheek here, this part which will be covered by the skin and the fat and other things, the cutaneous tissue, everything will be present here. That will be the cheek. So The cheeks are similar in construction or construction to the lips. So they are similar in construction, means they are made up of the muscles as well as they're covered by the skin, connective tissue, and everything. Deep inside this cheek, we have a thick muscle that is called as the buccinator muscle. Very, very important muscle which helps in blowing of air. So this is the cheek is mainly made up of the buccinator muscle from the main bulk of the cheek musculature and is continuously posteriorly with the pharynx. If you go behind, will be the pharynx. And this, along with this buccinator, there is a thick pad of fat which lies superficial to the buccinator muscle. So there will be a thick pad of fat which will be covering the buccinator. And in case of children, especially the small children who suckle the milk, in those cases this pad of fat is very thick, and that helps actually in suckling of the milk. It is well developed in children as it prevents inward drawing of the cheek during suckling. So it prevents indrawing of the cheek during suckling. Within this deep area, there can also we can see a small duct. This is called the parotid duct. This is the parotid gland here, and this is drained by a duct. This is called the parotid duct. And this parotid pierces the buccinator muscle opposite to the third molar tooth. So it will be opening into the oral cavity in the vestibule just beside the second molar tooth. But when it pierces, the buccinator will be at the position of the third molar tooth, and then it goes inside and it opens into the vestibule of the oral cavity. So this is the parotid gland, and this is the parotid duct which will be present here. Here it has been shown. Okay. So this is the parotid duct here, which is opening into the third molar tooth. It is piercing actually at the position of the third molar tooth, and it is piercing the buccinator muscle. So these are some of the contents which you can see. One is the skin, the superficial fascia filled with lot of a thick pad of fat. Then deep inside we have the buccinator, and there will be a duct, parotid duct, which will piercing the buccinator. So all these structures are within the cheek. Now coming to the blood supply of the cheek and the lip, it is mainly by the buccal arteries and the facial arteries. You will see the facial artery. Later I will try to show you the facial artery. It is not shown in this picture. Later we will see the facial artery, and these are the two arteries which will be supplying the cheek and the lip, the buccal arteries as well as the facial arteries. Coming to the lymphatic drainage of the cheek and the lip, the upper lip will be draining into submandibular group of lymph nodes, which will be just below the mandible here. So that's why they are called as submandibular. So there are submandibular group of lymph nodes, and the lip and the upper lip especially and the cheek will be drained into the submandibular group. But the lower lip as well as the chin will be draining into small group of lymph nodes here just below the symphysis mentae. This is called as the symphysis mentae. Just below this there will be a small group of gland. These are called as the submental group of lymph nodes. So this submental group of lymph nodes will be draining the lip. So the lower lip will be drained as well as the chin. This whole part, the lower lip as well as the chin, will be drained directly into this submental group of lymph nodes. Okay. Coming to the nerve supply of the cheek and the lips, it is the motor nerve supply is mainly by the facial nerve, and the sensory supply will be from the branches of the maxillary as well as the mandibular nerves. Now coming to the tongue. So the tongue is a very important structure in the oral cavity for the deglutition as well as the during chewing, to move the food particles to the side so that it will be chewed properly. So this tongue is a conical muscular organ. This is mainly muscular organ. There are no bones within that. So it is a boneless organ. It is a conical muscular organ located on the floor of the oral cavity. And it is covered by the mucous membrane. So here you can see here, this is the tongue which is covered by the mucous membrane, and it is mainly made up of the muscular muscles. So it is an extremely mobile structure. This help in speaking and production of words. So actually the voice is produced in the voice box in the larynx, but the production of words, to pronounce the words, this is very important, especially the twisting and turning of the tongue. So that's why it is extremely mobile structure. This tongue partly lies in the oral cavity, two-thirds lies in the oral cavity, and one-third lies in the oropharynx. Oropharynx is a part of the pharynx. When you study the pharynx, at that time we'll see the different parts of the pharynx. So one part of the pharynx is called the oropharynx, which is just behind the oral cavity. So this tongue lies two-thirds in the oral cavity and one-third behind will be lying in the oropharynx. Along with the cheek, it moistens the food between upper and lower teeth till mastication is completed. So this tongue helps mainly in the mastication of the food, the chewing of the food, and also in the moistening of the food and twisting and turning of the food particles so that it can be chewed properly. This tongue has three parts. So it has a root which is behind and which is in the oropharynx. This is the root, and a body and a tip. Tip is in the front. Most anterior part of the tongue will be the tip. Then we have a big thick part that is called as the body, and behind is the root. So these are the three parts of the tongue. And if you see below the tongue, there is something called as the lingualum frenulum, which we'll see later. In this picture it is not seen, but if you lift this tongue, then below that you can see there is something called as the lingual frenulum, so that which will be anchoring the tongue to the floor of the oral cavity. So it will be mainly connecting the tip of the tongue to the floor of the oral cavity. And we'll discuss later how, if it becomes shortened, what will happen. That is, it leads to a condition called as the tongue tie. It is an important accessory organ in case of speech. As I said, it is very important in case of the speech. Even though it is accessory, it helps in swallowing, phonation, production of sound, mastication, chewing, as well as the deglutition, swallowing. So all these movements are done by this tongue. This is the oral cavity. This is the oral fissure through which the food particles will enter into the cavity. This is the tongue. So this is the tongue. This is the tip. This is the body, and this is the root, which is in the. This is the pharynx here. There is three different parts of the pharynx. So here this is the oropharynx, which is behind the oral cavity. So this oral pharynx and this root will be present in the oropharynx. Mastication, this is how you masticate. This is the chewing of the food particles, and this is the swallowing. This just the funny pictures to understand the different concepts. Speech, when we speak, that is the speech, and phonation is when you make different kinds of sounds. This tongue is a mass of muscles, as I said, and these are striated muscles. So they are voluntary muscles. So we can do the movements ourselves. This is voluntary. So these are this tongue is made up of striated muscle covered by mucous membrane, interspersed with the glands as well as the fat. It is connected to the lower jaw, hyoid bone, skull, soft palate through different muscles. So it is connected to important different, because it is muscle, it cannot be free. It has to be connected to some bones. So it is connected to bones in the lower jaw, to the hyoid bone, skull, soft palate through different muscles. We will discuss about the different muscles which will be connecting all this tongue to different parts of the bones. It is connected to the floor of the mouth and epiglottis by folds of mucous membrane. So you can see the mucous membrane surrounding the whole of the tongue as well as to the surrounding tissue. It consists of small salivary glands called as the lingual glands, which produce some saliva necessary for swallowing. Main salivary secretion will be from the salivary gland, but a small quantity of the saliva is also produced by the lingual glands, which are small salivary glands which in the tongue. Coming to the functions of the tongue, it is an organ of taste, So we'll discuss about this later. So it has special sensation which is mainly helpful for the different kinds of taste. Okay, so this is the organ of taste. So we can feel the sweetness, sour, and all those salty everything by the presence of special sensory organs which are present within the tongue. So it is organ of taste, as well as it helps in mastication. It also helps in the moistening of the lips. It acts as a mirror image of various infections of the alimentary tract. If there are any infection, the doctor asks you, the physician asks you to open the mouth. Why? To see the tongue. And if there are any coatings of the tongue or something like that, or any changes in the tongue, that leads to a very important diagnosis. So that's why, so it is called as the mirror image for various kinds of infections. If there are any kinds of, sometimes it can be rosy in color, sometimes it is whitish in color. So all these different colors of the tongue and the changes in the tongue helps the physician to diagnose the different kinds of infections. It also helps in as a thermoregulator, especially in case of dogs. In case of dogs, when they run for a long time, they start panting. They open their mouth and they put their tongue outside. So this helps in the exchange of the temperature. It releases the temperature outside. So that's why it acts as a thermoregulator, not in case of human beings, but especially in case of the dogs, it is very prominent. Coming to the parts of the tongue, we have already seen it has three parts: the body, the base, as well as the tip, as well as it also has along with that the lateral margins. So these are the lateral margins on either side, the tip, body, and the root. Along with that, the base. Along with that, there are lateral margins, and we have the superior surface. What you are seeing, this is the superior surface and the inferior surface. The apex of the tongue, as I said, it is most anterior. So this is the most anterior part of the tongue. This is the side view to see the tongue from the side and appreciate the muscles which are present within them. So this is the tip of the tongue. It is directed forwards and come in contact with the incisor teeth. So these are the incisor teeth here, and it will come in contact with the tip of the tongue, which can be protected outside as well as moves on sides and other things. The base, which is behind, it is directed backwards and toward the oropharynx. It is connected to the epiglottis by means of median lateral glossoepiglottic fold. If you can see here, this is the picture of the pharynx, and you can see the tongue is this is the picture seen from behind, from here. Okay, so that you can see the posterior most part of the tongue. This is the posterior 1/3 of the tongue here. It has been labeled as posterior 1/3 of the tongue, and behind that we have the epiglottis. So this is the epiglottis here. So this tongue is connected to the epiglottis by folds of the mucous membrane on either side. These are called as the glossoepiglottic fold. So these are called as the lateral glossoepiglottic fold on either side, and in the middle there is a small one that is will be called as the median glossoepiglottic fold. So these are the nothing but the mucosal folds, lateral glossoepiglottic fold on either side of the tongue, and the which is connecting the tongue as well as the epiglottis. This is the epiglottis, and there will be a middle one that will be called as the median glossoepiglottic fold. On either side of this median fold, on either side of there is a depression. This is called as the vallecula. So deep inside here there will be depression on either side between the lateral and the median glossoepiglottic fold. On either side there are depressions between the tongue and the epiglottis, that will be called as the vallecula. The root is formed by the genioglossus and the hyoglossus. We will talk about these muscles, different muscles here. So here is the root of the tongue. So this is mainly formed by the genioglossus and hyoglossus. If you see this picture here, you can see here, appreciate these muscles. So these are called the genioglossus. Here, if you see the posterior part of the mandible, here there are something called the genial tubercles, superior and inferior genial tubercles. So these are from the genial tubercles which are coming here. So that's why these are called as genioglossus. They begin from the genial tubercles and go to the tongue. So that's why it is called as genial glossus. So especially they will be coming from the superior genial tubercles on either side. Okay, so this is the genioglossus, and the second muscle is coming from the hyoid bone. So this is called as the hyoglossus. So it begins from the hyoid bone and then extend upwards. So this is called as the genioglossus, and this is the hyoglossus. So these are the two muscles which form the root of this tongue. So the root of the tongue is formed by the genioglossus and hyoglossus. It extends from the symphysis mentae to the hyoid bone. So because they are beginning from the genial tubercles, so they extend from the from the symphysis mentae. So this is the symphysis mentae here, and it extends all the way to the hyoid bone because the other muscle is being from the hyoid bone, so hyoglossus. So this root of the tongue extends from the symphysis mentae up to the hyoid bone. It is the part of the tongue attached to the floor of the mouth. So you can see here, so this is the root of the tongue which is attached to the floor of the oral cavity. Okay, so this is formed by the genioglossus and the hyoglossus, two important muscles. And here you can see here in the inferior surface, you can see this is called as the frenulum of the tongue, which I was discussing. So this is the frenulum which will be connecting the tip of the tongue to the floor of the oral cavity. Here you can see here much more prominent. Sometimes it becomes very shortened, then it's due to a condition called as tongue tie. So here you can see a very prominent frenulum. Coming to the dorsum of the tongue. The dorsum of the tongue is the superior surface of the tongue, which covers from before backwards. So it is convex from the before backwards. So it is totally convex. You can see here in the picture where it is convex, right? So it is convex from before backwards and side to side also, and is covered by the mucous membrane, which is moist pink in color and lined by stratified squamous non-keratinized epithelium. So the whole of the oral cavity as well as the tongue is covered by stratified squamous epithelium. Stratified squamous epithelium, non-keratinized, it is not keratinized. Okay, so this is the type of epithelium which is lining the tongue as well as the oral cavity. It is divided into anterior 2/3 and the posterior 1/3 of the tongue. If you can see here, so it is divided into anterior 2/3 and posterior 1/3 of the tongue by a V-shaped furrow which is called as the sulcus terminalis. There is a sulcus or a furrow which will be dividing the anterior 2/3 from the posterior 1/3. So this is called as the sulcus terminalis. So this is the sulcus terminalis, and in the center here there will be a small foramen. This will be called as the foramen cecum. So this sulcus is a very important area which will divide the two parts of the tongue, which are developed as well as the functions are different for these two types. Anterior 2/3 and the posterior 1/3 are developed from different arches of the pharyngeal arches, and even the structure is different for these two, as well as even the function for this anterior 2/3 and posterior 1/3 of the tongue is different. They are developmentally different, functionally different, as well as even the structure is different. Now we'll discuss about the structure of the anterior 2/3 of the tongue, which is mainly present in the oral cavity. So this is the anterior 2/3 of the tongue, and this lies in the oral cavity and form the floor of the mouth. This is covered by mucous membrane and present with four types of papillae. Four types of different types of papillae, which are projections of the underlying lamina propria. So if you can see here, it is not smooth, but it is giving elevation. These are called as papillae, and these elevations of papillae are of four different types. The first one is the circumvallate papillae. If you can see here, this is the side view to show you how different this is, the circumvallate from other types. So this is the circumvallate papillae, which is circular in shape as well as it is broader in nature. So these will be present, they will be present in the just in front of the sulcus terminalis, and they are almost 10 to 12 in number. They are 10 to 12 in number, and the first papillae to develop as well as they lie in parallel to the sulcus terminalis. Sulcus terminalis is that furrow which divides the anterior 2/3 of the tongue from the posterior 1/3. So here will be the sulcus terminalis, the foramen cecum, and just in front of them will be the 10 to 12 circumvallate papillae. They are also called as the valid papillae themselves. Then we have the second type, that is the fungiform papillae. These are much broader papillae, but smaller compared to the circumvallate. So this is called as the fungiform papillae, and they are present on the sides as well as the tip of the tongue. They are present in fungiform. These are the fungiform papillae which are present in the side as well as tip of the tongue. Then there is the filiform papillae. It is a V-shaped papillae. So it is totally different from the circumvallate as well as the filiform. This is the V-shaped papillae, and rows parallel to the valid papillae, and apex as well as the transverse in direction. So here you can see here the filiform papillae which are parallel to the valid papillae, and they are also present some in the apex as well as they are present in the transverse direction. Then there is also a fourth type which is called as the foliate papillae, and this is especially at the end of the palatoglossal arch. They will present small papillae. These will be called as the foliate papillae. Here you can see here, and so these will be few papillae which are present at the sides, especially at the end of the palatoglossal arch. Those will be called as the foliate papillae. The posterior one-third of the tongue, as I said, it is structurally totally different from the anterior two-thirds. So this part of the tongue doesn't have, even though it is rough, it doesn't have the papillae. So it is devoid of papillae. Devoid means they are not present. So there are no papillae in the posterior one-third of the tongue. So this is the anterior two-thirds which is covered by a lot of papillae, but the posterior one-third is devoid of papillae. But still it is rough. Why it is rough? It consists of nodules of lymphoid tissue in the submucosal coat. So that's why it gives small elevations, and because they are presence of the nodules of the lymphoid tissue, so it is called as the lingual tonsil. Lingual tonsil, because it is present in the lingula or the tongue, and because the nature of this is similar to that of the tonsil, which are nothing but the lymphoid tissue. So because there is a large collection of the lymphoid tissue here in the posterior one-third, so it is called as the lingual tonsil. And you should remember, this posterior one-third of the tongue is devoid of papillae. Coming to the lateral margins, as I said, it is also covered by the mucous membrane, and it gives indentation to the teeth. If you can see this side, you can see the impression of the teeth, and it lies in relation to the inner surface of the teeth and gums of the mandible. So these will be the lateral margin which will be directly in contact with the teeth as well as the gums. Coming to the inferior surface of the tongue. Now this what we are discussing was the dorsal surface. Now what we are talking about is the ventral surface, the inferior surface of the tongue. So this is smooth and purple in color, and again this is also devoid of papillae. You should remember, even the inferior surface or the ventral surface is devoid of the papillae. So there are no papillae in the inferior surface, and it is covered by mucous membrane and is reflected to the floor of the oral cavity or the mouth. So it is in directly contact with the floor of the oral cavity. So in the midline of this, we can see the frenulum linguae, which I was discussing. So the small mucosal fold which connects the tip as well as the inferior surface of the tongue to the floor of the oral cavity. So here also you can see the frenulum. And at the sides we can see deep veins here. If you can see here the impression of deep vein, this is because of the deep lingual veins which will be draining the tongue. Along with that, we can also see the plica fimbriatum. Coming to the muscles of the tongue, there are two types of muscles which form the tongue. One is the extrinsic muscles, which are the main striated muscles which help in the movement of the tongue, and there are other type which are small muscles within the tongue. These are called an intrinsic. Intrinsic because they are within the tongue, and extrinsic are the muscles which are coming from outside and they are forming the structure of the tongue. So there are four extrinsic and four intrinsic. The four extrinsic are the genioglossus. We have already seen the genioglossus, as well as the hyoglossus. Genioglossus is the muscle which is coming from the genial tubercles of the mandible, superior genial tubercles of the mandible, and which form the tongue. So this is the genioglossus. Then hyoglossus, which is coming from the hyoid bone. The third muscle is the styloglossus, which is coming from the styloid process. So this muscle also comes from the styloid process and form the tongue, mass of the tongue. And the fourth is coming from the palate. So this is called as the palatoglossus. It is coming from above, from the roof of the oral cavity. So there are some muscles which are coming from the floor, some are coming from the behind, and some coming from the roof. So different muscles are coming from different side, and they pull. When they pull, and this helps in the twisting and turning of the tongue, which helps in the movement of the tongue as well as the speech. There are also four different types of muscles, intrinsic muscle. These are the transverse, linguae. Then we have the vertical muscle, superior longitudinal as well as the inferior longitudinal. We will discuss about this intrinsic muscle later. First, we will discuss about the extrinsic muscle. So here also you can see here, this is the styloglossus muscle, this is the genioglossus, and here we have the hyoglossus. So all these muscles and palatoglossus will be coming from above. So what are the actions of these extrinsic muscles of the tongue? Why there are so many extrinsic muscles? As I said, they help in the twisting and turning of the tongue. So what is the function of the genioglossus? Because it is present from the genial tubercles here, it draws the tongue forwards. Whenever it contracts, it helps in the movement of the tongue forwards and in protrusion of the tongue outside from the apex from the oral cavity. So it helps in the protrusion of the tongue. This is the function of the genioglossus. Hyoglossus is present in the floor, so it helps in the depression of the, whenever it contracts, it helps in the depression of the tongue. Then we have this styloglossus, which is coming from behind, so it helps in the drawing of the tongue backwards, which is called the retraction of the tongue. So whenever you want to pull the retract the tongue, so this styloglossus will help. And when you want to elevate the tongue, sometimes you're doing speech as well as during swallowing and other things, you are supposed to elevate the tongue. So this is done by the palatoglossus, which is coming from the above. So it pulls the root of the tongue upwards and backward. So this is called the elevation. So there is muscle hyoglossus, which helps in the protrusion of the tongue. Then the hyoglossus, which helps in the depression of the tongue. A retraction, which is done by the styloglossus, and elevation by the palatoglossus. So these are the different muscles and their functions. So this is the example of protrusion of the tongue, which is done by the genioglossus. Then retraction done by the styloglossus. Then the elevation done by the palatoglossus, and depression by the hyoglossus muscle. So these are different movements which are shown here. Protrusion, the retraction, pulling behind. Then this is the elevation of the tongue, and here the depression. Whenever you make sounds, especially when you breathe in, at that time there will be depression. Then coming to the intrinsic muscle called as intrinsic muscle because they are within the tongue, they are not from outside. So these intrinsic muscles also help in the altering the shape of the tongue. They are within the tongue, and they help in the altering of the shape of the tongue. Especially there are four different types of muscle. We have the superior longitudinal, which are the longitudinal muscles above. These are called superior longitudinal. Then we have the inferior longitudinal muscles, which are from the root to the tip. Okay. Then we have the transverse muscles, and we have the vertical muscles. So these are the four different types of muscles. The superior longitudinals from the tip to the sides and upward dorsum concave. So this superior longitudinal helps in the side upward dorsum of the concave. Then the inferior longitudinal is present the tip and sides downwards and dorsum convex. So this superior longitudinal helps in the tip and sides upwards and the dorsum concave. So it helps in the sides on either side to become upwards, and this helps in the concave shape of the tongue. Usually it is convex, but whenever the superior longitudinal contracts, the two sides will come closer and then it becomes concave. Okay, the inferior longitudinal helps in the opposite movement, helps in the convex of the convexity of the dorsum of the tongue. Then we have the transverse, which narrows the tongue and it elongates the tongue, because whenever the two sides will be pulled, then it becomes narrow, this part becomes shorter and it becomes longer. So that is the function of the transverse. Then we have the vertical, which helps in the pulling of the tongue downwards and broadening of the tongue as well as flattening of the tongue. So these are some of the muscles of these intrinsic muscles: superior longitudinal, inferior longitudinal, transverse and vertical muscle. So there are four extrinsic and four intrinsic muscle. Then we have the coming to the arterial supply of the tongue. So the arterial supply, this tongue is highly vascular. It is supplied by four important arteries. One is the lingual artery. So if you can see here in this picture, so this is the external carotid artery, and this is a branch of the external carotid. There are 8 branches of the external carotid, and this is one of the branch. So this is called as the lingual artery, which is going all the way. It is very tortuous and it goes all the way to supply the tongue. So the lingual artery is one artery. The second artery is the ascending pharyngeal artery, that also supplies the tongue, the ascending pharyngeal artery. Then we have the tonsillar branch of the facial artery. The tonsillar branch, here you can see the facial artery. It has a tonsillar branch which helps in the, if you can see here, they have shown the tonsillar branch of the dorsal lingual artery. And similarly, we also have a small branch from the facial artery, tonsillar branch of the facial artery, which also supply the tongue. Then we have the ascending pharyngeal artery, also supply the tongue. There are 4 different arteries, all have not been shown here, but you can imagine the main artery will be the lingual artery, which will be supplying the tongue, along with the pharyngeal palatine artery, ascending palatine artery, then the tonsillar branch of the facial artery. So this is the lingual artery here, this is the facial artery. Facial artery also gives a branch, but the main artery will be the lingual artery. Then also the ascending pharyngeal artery. All these 4 arteries will be supplying the tongue. Coming to the venous drainage is draining the tongue. So the dorsum and side will be mainly drained by the dorsal lingual veins. If you can see here, these are the dorsal lingual veins on either side on the dorsum of the tongue. So this will be joined and drain into the, then finally into the lingual vein. Then we also have the deep lingual vein. If you can see here, this is the deep lingual vein, which also commences at the tip of the tongue and joins with the sublingual vein to form the vena commitans hypoglossae, and then finally drains into the lingual vein itself. Both these veins opens into the internal jugular vein or lingual vein or the facial vein. Usually their main drainage is into the internal jugular vein. Sometimes it also drains into the facial vein. So this is the venous drainage of the tongue. Coming to the nerve supply, very important feature of this tongue is the nerve supply, because it has very special sensations, especially the taste sensation. So this tongue, as you know, it is divided into anterior 2/3 and the posterior 1/3. Even the nerve supply is different for the anterior 2/3 and the posterior 1/3. So the anterior 2/3 of the tongue, which is present in the oral cavity, the general sensation will be by the mandibular nerve via the lingual nerve. If you can see here in this picture, so you can see here the lingual nerve. Here also in the previous pictures we could see this is the lingual nerve here. So this whole thing is the lingual nerve. So the same lingual nerve here. So this is the lingual nerve, which will be mainly sensing the general sensations. So it is mainly from the general sensation is by the mandibular nerve through the lingual nerve, and the special sensation is of taste is mainly the sweet, sour, everything. The special sensation is by the facial nerve through the chorda tympani nerve. So here you can see the chorda tympani nerve, which comes here all the way, and it takes the special sensation. It is mainly from the facial nerve through the chorda tympani nerve. So the anterior 2/3, the special sensation by the chorda tympani, and the general sensation by the lingual nerve. The posterior sensation, the posterior one third of the tongue, both the general and the special sensation by the glossopharyngeal nerve. Glossopharyngeal nerve. If you can see here, they have shown you the glossopharyngeal nerve. So this is the special as well as the general sensation. For the posterior one third, the general and special sensation is by the same nerve, glossopharyngeal nerve. But for the anterior two thirds, the general sensation is by the mandibular nerve via the lingual nerve, and the special sensation is from the facial nerve through the chorotympanic nerve. The motor supply of these muscles, the intrinsic and the extrinsic muscle, is by the hypoglossal nerve. Hypoglossal nerve, you can see here, this is the 12th cranial nerve. So hypoglossal nerve will be the main, it is called as glossal. So because hypo, because it is below, and glossal because it is supplying the tongue. So hypoglossal nerve, all the intrinsic and the extrinsic muscle of this tongue is supplied by the hypoglossal nerve, except the palatoglossus, which is supplied by the vagus nerve. All other muscles by the hypoglossal nerve. 12th cranial nerve, except the palatoglossus, is supplied by the vagus nerve, which is the 10th cranial nerve. So this is the nerve supply of the tongue. Coming to the lymphatic drainage of the tongue, the tip of the tongue is drained directly into the submental group of lymph nodes, which are just below the mandible. So the tip of the tongue, the lower lip, as well as the chin, all these areas are supplied or drained into the submental group of lymph nodes. Coming to the margins are draining into the submandibular group of lymph nodes, and from there into the jugulo-digastric as well as jugulo-omohyoid group of lymph nodes. The central, these also drain into submandibular group of lymph nodes, from there into jugulo-digastric as well as the jugulo-omohyoid. The dorsal part of the tongue, this directly drains into jugulo-digastric as well as the jugulo-omohyoid group of lymph nodes. So this is the lymphatic drainage of the tongue. Development, I will not talk to you in detail about the development, just I will show you because it will be a totally separate class for you to study the development of the tongue. So here the anterior two thirds of the tongue is developed from the lingual swellings. If you can see here, these are the lingual swellings which later form the anterior two thirds of the tongue. And the posterior one third is developed from the cranial part of the hypobronchial eminence. So here this is the hypobronchial eminence. So this will be, especially the cranial part of the hypobronchial eminence will be forming the posterior one third of the tongue. If you can see here, so this is the hypobronchial eminence which is forming the posterior one third of the tongue. Anterior two thirds by the lingual swelling, the two lingual swelling on either side join together to form a large anterior two thirds of the tongue, and the posterior one third by the hypobronchial eminence. And the muscles, this is about the especially the skin. The muscles are developed from the something called as the occipital myotomes. This is the embryo, and these are the occipital myotomes which are present here. So these are the cervical myotomes, and these are the occipital myotomes. The occipital myotomes will migrate, and they will be forming the musculature of the tongue. So we'll discuss in detail about this when we discuss the embryological part of this one. Now coming to some of the applied aspects of this tongue. One is the macroglossia. Macro means big, large tongue. So it is not uncommon, and it is muscular hypertrophy of the tongue or enlargement of the because of the tumor. Usually it is hypertrophy of the muscles which are supplying which are mainly forming the tongue. So when they hypertrophy, at that time there will be a large tongue, and it will be the oral cavity will be filled with the tongue itself. Then sometimes there can be microglossia, just opposite to a very small tongue. It is an abnormally small tongue, and especially whenever this microglossia, it will be associated with the underdeveloped mandible. If you can see here, there is no development of the mandible as well as the recession of the chin. So together this is called as the macrognathia. So here this is the small tongue, this is called as the microglossia. Sometimes there can be bifid tongue. Sometimes the tongue is, as we have seen, they are developed from two lingual swellings. Sometimes they fail to join together completely. At that time you can see bifid tongue. So incomplete fusion of the lingual swellings, there is a deep median groove. So you can see here this deep median which does not reach the tip of the tongue. So here it has fused, but here it has not fused. Here also you can see here. So it is small depression. This is called a bifid. Very uncommon anomaly, very rarely seen. But if you can see the snake, in the snake it is bifid tongue, because there it is no the two lingual segments don't join together. So you can see the bifid tongue, it is normal in case of the snakes, but in case of human beings it is very uncommon. Sometimes the due to incomplete descent of the thyroid gland. The thyroid gland is developed from the foramen cecum. From there it descends downwards into the actual position where it is present in the neck, but sometimes it doesn't descend downwards. So because of undescended thyroid gland, so you can see this within the tongue. This is called as the lingual thyroid. So this one more type. And as I was talking about the short frenulum is the small mucosal fold which connect the tip as well as the lower surface of the tongue to and connects it to the floor of the oral cavity. So sometimes it becomes shortened. So this is called as the tongue tie, or it is also called as the ankyloglossia. Ankyloglossia or tongue tie. And this, whenever you speak at that time, if the person has this tongue tie, then there will be difficulty in moving of the tongue as well as difficulty in speech as well as feeding. So this can be corrected very easily by just giving a small niche here, small cut here, and they release the tip of the tongue so that there can be better feeding as well as better speech. So these are some of the anomalies